All right, so are people unmotivated? Well, we have that attitude pretty prevalent within our healthcare system. And the consequences of that is we try to focus on motivation, get people pumped up, and increase their motivation. We also tend to prescribe for them lots of behavior change and create failure experiences for them. And then we become very frustrated because people won't change, and very cynical. They're really unmotivated people, and they don't know what's good for them. But a couple of questions. Do we really know what motivates people? Have we discovered that? How do we make it easier for people to do the things they already want to do that they're motivated to do? And have we really identified and celebrated the successes when they are successful at doing something? I think that's an antidote as we answer those questions to the usual approach we take to prescribing failure. So here's the question. We're all concerned about obesity. Where should we focus? Which part of the curve? Do you focus on that part of the curve, the most difficult, recalcitrant, difficult to change? Or do you focus on shifting the population curve, where you have a lot of people who are ready and willing, they just want to know how. They just want, and my advice right now is if we just focus primarily, I don't say ignore other people, but focus on the people who are ready and willing and want to make a change and help make that change easier and more successful for them, we are likely to shift the population curve and get much more area under the curve than if we focus all our time and resources on the most difficult to change. Does it make sense? Okay, so what do people care about? I mean, we say they're unmotivated. So, you know, we come in and we're talking about preventive screenings and exercise and healthy diet. And when you survey people, what do they really care about? Well, I call it the 3 S's. They care about stress, they care about sex, and they care about sleep. Now, they're not unrelated to the other side, but in real life, okay, these are some of the primary concerns. In fact, a study was done of young Kaiser Permanente members, and they called these health hassles, okay? These are the things they don't think of going to the doctor for, but the things that are really bothering them: stress, sex, and sleep. So a study was done by ELISA, which is an IVR company. They do a lot of research on interactive voice response. And they surveyed about 1,000 people. And they kind of asked them, what are your major concerns? Okay? And interestingly enough, they find money concerns, unhealthy sex life, relationships, caregiver stress, job stress, diet, and exercise. Okay? Now, I find that kind of interesting. Okay? So where do we focus most of our attention? We focus it on diet and exercise. And what are they concerned about? And remember, we're calling them unmotivated. Okay? But they may be motivated because of pressing concerns in these other areas. So what does that suggest to us? It suggests that our interventions, if they're going to engage people, also need to address some of the areas of stress, sex, sleep, with behavioral and health coaching type interventions and other things that we could do. I'm not saying ignore it. And the other thing is, we call them unmotivated, and then we dump on them 100,000 things to do and overwhelm them. So, for example, Montori has done a wonderful thing called minimally disruptive medicine. If you haven't heard this, go search YouTube for minimally disruptive medicine. There's a wonderful little video in which it talks about you take somebody who's kind of demoralized coming into the healthcare system, they're overwhelmed with stress, they got teenage daughters, job is not going well, and so on, and we say to them, here are the 15 things we want you to do to manage your diabetes, okay? And we have added to their burden. So, for example, when they surveyed patients with type 2 diabetes, and they surveyed diabetes educators, and they asked them, what are all the things that a patient should be doing? And it would take about 2 hours a day more to do all those things the diabetes educators thought they should do. Well, what's wrong with that picture? Who has 2 hours extra? One of the major obstacles that most of the patients say back, I don't have enough time to do all that. And the implications are we need to help prioritize, consider patient preferences, and really respect time and help guide them to the things that are likely to have the highest payoff.